Hi, good morning, everyone. My name is Henriette Abrams, and I'm from Bonteheuwel. I'm the chairperson of the Bonteheuwel Development Forum. Now, the Bonteheuwel Development Forum consists of street and block committees. Members to street and block committees must live on a street and must be a resident or tenant in Bonteheuwel and over the age of 18. I was asked to do this interview with regards to the impact that COVID-19 had on communities. And for me, it's particularly working class communities. So, with the December holidays, we all have been focusing on what has been happening in China, in Wuhan at the time, in Italy and Spain and so forth, in France at the time. So we kind of, in my mind, I thought that this thing was going to come to us as well. It's going to be some time. So we have been organizing in the past 3 years. We've been organizing around primary health issues, around civic issues, around violence against women and children issues, and so forth, in our various blocks and on our streets. So on the 27th of March 2020, when the President Cyril Ramaphosa announced the lockdown level 5, we as Bonteheuwel were kind of ready because we anticipated it. Because of our work that we are doing in streets and blocks, the primary health care and so forth, we kind of knew already who our sick, our aged, our immunocompromised people were. So we immediately, prior to the 27th, we went in our blocks and on our streets and we fine-tuned that database. So we knew whom to respond to, who our first responders would be. We had the contact details. We had people on our streets on the lookout should there be any cases or help needed for that matter. So when everybody took to the covers after the announcement, our organization did not take to the covers. We actually ran out in the streets and we were there to support our people. The saddening and disappointing part is that those public servants and civil society organizations who were supposed to have served our people and be there for our people took to the covers. They all took to, they first went into isolation. Your councillors, your ministers, all your public servants, and your big civil society organizations, even your trade unions for that matter. So the servants of the people went for the bunkers while the people were left vulnerable. Now you must remember that the 27th of April, our people did not get the social grants yet. So the SASSA grants, the pension grants, the child grants, the disability grants, all of those things, our people did not get that yet. And it was the last week of the month, and the last week of the month, we know our people on our streets. Our people are scuttling, they're hustling for bread, for electricity money, for all of those things. So we were very aware of this, and we knew that if our people had to be under lockdown level 5, they would not adhere to the legislation and the regulations, because they would risk their lives getting this virus in order to put a piece of bread on the table or to get electricity money or whatever the case may be. So what we have done, and also considering what the essential needs of our people were and what they can afford. So with lockdown level 5, for instance, they said we must all wash our hands, we must use sanitizer, we mustn't touch A, B, and C, we must sanitize our places and all of those things. then you have to realistically ask yourself, whom of our people could afford sanitizer? Whom of our people have enough soap or sufficient soap? With also the fact that some people had, a lot of our people have these blue water meters that is on a drip system. Some of are on a drip system, and some have X amount. So in my neighborhood, for instance, a couple of houses away from me, I've got 17 people living on one premises, and they on the blue water meter system that gives them what is it, 50 liters of water a day or something. So they won't be having this water to sanitize them all the time, or having the soap, or having all of those things. And most of these people are living also on social development grants. So by the 26th, so we organized prior to the 27th, the announcement. So by the 26th of March, we fundraised. We went out on a limb. We fundraised amongst ourselves as community members. We've asked for contributions and so forth. We went to the stores, wanted to buy masks. The masks were all out. The gloves were all out. All of these things. So we went, and typically, because we on the Cape Flats and we have a lot of retired and retrenched textile workers, we've asked a number of our women who could sew to make fabric masks. So we've made these masks. We went out and we bought like Dettol soap and gloves and all of these other things, and we made hygiene packs. That was our first parcel that so we thought, if this thing is coming, if Wuhan is coming to us and it is that bad and people are losing their lives and they're being hospitalized, at least let us keep our people safe. So we then gathered, made the masks, made the hygiene packs, and we gave that to our most immunocompromised residents within our blocks, on our streets. And you didn't have to be a member or so forth. We just took it. These are the people that we have to keep the safest, and therefore these are the people that on our blocks, on our streets, that would qualify for these things to ensure. We also went around educating our people about what the virus was all about, and how do we keep our elderly and our sick safe, and what is the responsibility of the youth and others that's out and about on the streets, going to shops and so forth, in terms of keeping the elderly and the sick safe. So we've done a lot of that work prior and during a lockdown level 5. Now, coming back to the fact that people didn't get paid and there wasn't food at houses and so forth, that forced us to also look at food parcels. So we've done the food parcels where we took the basics. We've made a plea to any and all, be you living on our streets, be you outside, be you formerly from Bonteheuwel, be you a friend of Bonteheuwel, be you abroad, wherever. We just went out to everybody and begged and pleaded so that we could feed as many people as possible. Now, having to go and purchase and make up the packages, we had to set up kind of a warehouse type of operation here in this house of mine, to package and then to get it out to the most needy. Now, in each block, we would identify who are our most needy, how many people are in the house, what is the size of food parcel that you would give to this house in comparison with another house, because we have households where there's 45 people, in another street there's 55 people on one property, so you cannot give the same parcel somewhere. Of course, everybody was in need, and there was such a big need for it, and it became difficult to continue that process. We did it for level 5, I think. We've managed to give about just under 2,000 food parcels over a 5-week period, and that was a lot of hard work, a lot of self-sacrifice, a lot of adding and giving your time selflessly and your energies. So then we found out that this food parcels isn't sustainable. because we won't be able to give people food all the time, and that we are not government, so we're doing government's work, but we are not government and we don't have the means and resources to continue in this fashion. So that made us relook our food security strategy, because there was, what COVID did was it exposed the hunger, the issue of hunger. It exposed the issue of inequality. It exposed the issue of poverty. It brought it to the fore. Lockdown level 5, what it did, level 4, it forced our people into the streets, and it forced, I think only in lockdown level 4, level 5, the forces that might be, then came with the tools, with the Zoom meetings and team meetings and Jitsi meetings and I don't know, whatever meetings in the safety of their homes to discuss food security or food insecurity. And that's what it was, and that's where it stayed. It was discussing food security and not doing anything. Not government, not civil society, not academics. Nobody came to the fore to be on the streets with our people and help our people survive day to day during this pandemic. During the first 3 lockdown periods, that's in my experience. So what we've done is we've relooked our strategy. We've moved then to opening up feeding schemes, because there was lots of hunger and our children are hungry. And the one thing that got to us is that you have so many children that is siblings that's looking after their younger children. So we've opened up feeding schemes, 2 feeding schemes per block. We have 17 blocks in Pontyville, so that means that we had 34 feeding schemes in Pontyville that stretches from Vanguard Drive on this side, from the train track, 2 in, 2 on that side, Kalkstein, Kreefgat, and Kalkstein 1, 2 in the entire Pontyville. So Pontyville has got a population of 85,000 people, and we have managed to serve between 45,000 and 50,000 meals a week. Now, honestly, we are not the Department of Social Development. We are the Pontyville Development Forum, and government has let us down. Civil society has let us down. They've thrown us to the dogs, and we as individuals had to come and had to fill those spots. What COVID has also shown, what I've alluded to earlier on, is how little children are seeing that their siblings are in the line. Dishing time from the mornings to the evenings, it's different times, to see that a child gets her sisters and brothers in queue, in line, an hour and a half before the time, just to ensure that they're getting that meal for the day, is heartbreaking. To see the state that our children are in, having to fend for themselves, the fact that that they are poor, they don't have water, that they are living in overpopulated spaces, they couldn't care about whether they should get the virus or not, as long as they got something in their tummy. That to me was heartbreaking, and therefore we went all out and we've tried to serve as many times as possible. Some kitchens served 2 meals or 4 meals a week, with porridge in the morning and supper at night, and other kitchens served every day, because we have pockets of abject poverty in Pontyville, and those pockets, they kind of serve 2 meals every day, so it's 5 days a week and some 7 days a week for that matter. What we then did as a community, because now we're having to fill those 100-liter pots. A 100-liter pot can feed between 250 and 300 people, depending on what you are cooking. So then we said, no, but we cannot be buying and going to the market and buying so many cabbages and so many pockets of potatoes, so many pockets of onions, of whatever the ingredients were. We then decided that we needed to go over to our food gardens, which was actually in our action plan for 2020, but then COVID just kind of made it difficult, because our focus then had to shift on feeding our people and getting hygiene packs and all of those things. So we immediately had to move over to planting our own foods. So what we've done is we've had a competition. We've asked the blocks to go and find some land, be it on a school, on a field, on a pavement, or wherever, and to plant food. And then we fundraised and asked and begged again for donations for seeds and seedlings and all of those things. But us, especially our women and our children, took to the lands and we've planted. We planted whatever we could get to grow. So collectively now in Pontyville we have 8 gardens, including where I'm sitting now is supposed to be the BDF nursery where I just do cutlings and seedlings and all of those things and pushing it out to the gardens. Collectively now we have about 3 hectares of land in Pontyville if we put the lands together. And we are managing, not big yet, we are managing to harvest and get some vegetables out of our gardens. So we're planting vegetables, we're planting herbs, and we're planting medicinal herbs also. We also have a ratio as to what you should plant, how much vegetables, how much medicinal herbs, and how much edible herbs for that matter. We took our women, the BDF Women's Assembly, we sent them on a course, we took them to Kirstenbosch, we had several other courses and programs on planting, healthy lifestyle, what herb is for what veggie is serving what needs, and our women enjoyed that, and they keep on sharing the knowledge of health and growing our own food, and they keep on sharing and exchanging seeds and seedlings and so forth. So COVID has been good to us in the sense that we saw the opportunity, we seized the moment, and we've pushed ourselves as an organization, as a community, we pushed ourselves forward. Where others ran to the bunkers, we ran and we mobilized our own forces, our own community, our human resources, and it made us more aware of all our issues in terms of health, in terms of food insecurity, in terms of socioeconomics and all of those things. So people must also remember, so now whilst we had COVID, before COVID, the Cape Flats, in some of our areas are gang-ridden, and we used to death and violence, shooting, killing, violence against women, abuse, and all of those things. So we still, under the COVID conditions, we still had to organize around those things. We still had to be very aware of where the gang violence is, and how do we keep our people safe, and how do we address the gang violence under a pandemic for that matter also. So nothing has stopped. Then of course we also had a humongous amount of our people who were working on the periphery of the economy losing their jobs. So our queues became longer. The pots were just blessed because we just kept on feeding. The queues became longer, and as you know that for some people it's a matter of pride and dignity. They did not at first want it to be seen in the feeding schemes because they were supposed to be okay, and now your neighbors are seeing that you are not okay. But luckily through the support and the holding of our organization, and especially our women, we could make these people feel that it's okay not to have, because so many of us don't have. We also had a number of evictions because there's a number of tenants and people who can't, and people who don't understand, that don't want to understand and accept that there's no income, so they threw people out, and we had to deal with that. We also had to deal with a number of sexual violence under COVID. We had to deal with a number of COVID-related and other trauma. We had to deal with suicide, and suicide amongst our youth more so also, in terms of trauma. So COVID threw so much on our plate, and it made us so aware, and we had to network with little to no resources to get whatever tangible and intangible help that we could get from anybody. And the sad part is, yet today we're coming out of the second phase of COVID, probably moving very soon into the third wave, and there's no economic changes. Sona was on the other day. Globally, nobody's talking structural change. Nobody is talking economic change that is throwing this entire world into the situation that we are having. If nobody is addressing the white elephant in the room, because we are all, or they are all, standing in the shadows and going on, it is the best system. Capitalism is not the best system. It is capitalism that is causing what we are having, the inequality, the deep poverty that we are having. So even through COVID and having lost millions and millions and millions of people around the globe, still the forces that might be are not willing to discuss changing the world economic system that is fair and just to all of us across this land and the globe. Thank you.